Depressed people, please stop being angry that when you're complaining about your mental health to your friends and family they suggest seeing a therapist. That's exactly the advice non-professionals should be giving you. Directing you to professionals. We get about 24 posts a day by people with depression/other mental health issues accusing their friends and family of being lazy/uncaring when they direct them to therapy. Guys, your friends and family are not capable of helping your mental health issues. They are just regular people like you. They should not be giving out medical advice, but instead they should be directing you to professionals who can help. I don't see diabetics on here complaining their friends and family don't give them medical advice about how to handle their diabetes. We don't have cancer patients complaining their friends and family aren't giving them cancer treatment advice. Just people with mental health issues complaining they aren't getting free professional level medical advice from people who aren't professionals. If you want mental health to be considered a serious medical concern, quit working against your own ideals and demanding random people help fix your issues. That isn't their expertise. Go see a therapist. To clarify this post, no. I am not saying don't talk to your friends and family about your issues, including, or even especially, about your mental health concerns. I am a massive advocate for communication among the people important to you about any problems in your life. Light on a problem usually helps to fix it. What I am talking about is explicitly mental health advice. Advice is a different thing from listening to you vent. Guidance is when a friend or family member who doesn't know what they are doing or has issues or biases can make things a hell of a lot worse. If your friends and family are directing you to a therapist, that is the best they can do. They are likely correctly feeling that they don't have the experience to give you advice. The best thing to do is direct you to a professional. And I'll tell you what, guys. I would be very wary of the advice you get from people who are very confident and cavalier about advising on essential topics they aren't trained in. And mental health is an important topic that shouldn't be taken unseriously. As a person who suffers with anxiety and depression, this is the exact advice I give to my friends in the same boat. I do my best to be a friend but always suggest they see a therapist. It's a third party who has no emotional investment in your choices and can give educated and straightforward advice and suggestions. I didn't make any actual progress with my mental health until I saw a therapist. I can understand the initial resistance to the idea. It is scary and uncomfortable, but it's the best thing you can do for your mental health. I think the anger comes from this idea that the other person isn't listening or doesn't want to hear. Which is something to understand about people with depression or feeling low, is that negative things are very accessible to them. It's hard for them to see the other side because they don't realize they're interpreting information thrown at them in a negative way. If you're going to tell someone to seek professional help, tell them in a way that says you care for them, but are not equipped to get them out of what they are going through. It does take a lot of trial and error to find the right therapist and the right medication. That might be a deterrent for some because they fall into a pattern to where they rather suffer than to try. This is from my personal experience. Of course, there may be other factors that vary person to person. Sometimes it helps venting to family and friends, but it's better to seek someone with expertise on dealing with depression and how to cope or manage it. Advice for people with depression. Ask the person if they're in the right headspace to hear about your troubles beforehand. It'll save both of you some burnout and frustration. TLDR, insurance coverage, appointment times, demographic and geographic fit, patient/doctor compatibility can all act as major obstacles in securing professional help. By all means, suggest therapy. But don't act like it's an easy process or a complete fix. I think a big roadblock for many people is the financial burden. Many therapists will suggest you also see a psychiatrist, then you might have meds. Some therapists cost up to $300/hour and refuse to see you less than once a week. If insurance doesn't cover, you're screwed. Also, the fact that finding a good therapist/psychiatrist fit involves reliving your trauma over and over to each new person and forking over $250 for an intake appointment where the patient does all the talking. This is not a good incentive for people struggling with mental health. Also, Many therapists/psychiatrists are very inflexible in their available session times, so if you're a full-time employee or college student, which most people are, good luck finding an appointment time that isn't incredibly inconvenient. Additionally, if you look up demographics, there are a lot of old, white males dominating the psychiatry/therapy realm. As a young, female POC, I do not relate to these people at all, and so, my pool of therapists/psychiatrists that I feel I can relate to on a personal level dwindles significantly. Add in geography, insurance coverage, session times, whether they're accepting new clients, and you've got a grand total of 2 professionals who meet your criteria. Can't afford it, and also parents won't allow me. If they're dumping on people, yes, but I do my absolute best to not burden other people with it. Having people in my life come at me saying get therapy is annoying because there's no way in hell I can afford it. Like, yes, my head is fucked. But do you think I wouldn't be in therapy if I could go? It's like walking up to someone with a broken elbow and telling them to see a doctor. No shit. I just wish people would leave me the hell alone about it. If other people aren't obligated to listen, why am I obligated to be nice about them, endlessly commenting on shit that don't concern them? All you non-depressed people have to understand how when we do get frustrated, people say that because of how many times we have gone to professionals and they have not helped us, they've either committed us for months that resulted in medication dependency and terrible side effects but not an actual cure to mental disorders. Or they have a shift medications at his trial after trial of new medication that supposedly works this time. Sometimes we just want someone to listen to our woes and tell us that our feelings are legitimate and okay for us to be feeling. There's a lot of guilt associated with mental illness. Definitely shouldn't be asking random people for advice when it comes to mental health issues, but at the same time it is nice to have people that can listen, just listen and that's it, respond that they've heard what you said and that your feelings are valid and matter. Honestly, even though it sounds mean, I agree so much. I had a friend who would use me as their venting/therapist friend, and the entire relationship was based on them texting me right before I went to sleep and venting to me about their issues every night for about 4 hours, and then I'd try to help them out with any advice I had and they'd say they were going to kill themselves and then go to bed and leave me thinking they'd done it. I constantly requested that they see a therapist or call a suicide support line, and they'd say I don't trust therapists. Our entire relationship became based on them constantly venting to me about anything and everything minimum 3 times a week. Aside from that, they never texted me, we barely talked privately about anything else. One day I wasn't awake when they started texting me, or I fell asleep early. I woke up to lots of calls and texts saying all sorts of suicidal stuff, sending me gory pictures of self-harm, saying that they were going to do this to themselves. I was going through my own shit too and was talking to no one about it because I felt like I was high functioning, so there was nothing that was depressed about me because I took showers and got high grades. I was so triggered by it, those months of carrying someone else's emotional baggage, constantly being reminded of my own shit, constantly being exposed to very traumatic information every night, and feeling afraid that a friend would die if you didn't do something for them, that on that morning when I woke up I tried to kill myself, and I really fucked my body up. I think that it's okay to vent to your friends in moderation. It's important to let those around you know that you're struggling. But you have to make sure that your friend can vent to you too. You can't just take. Compassion fatigue is a real thing and other people are going through things too.